Dr. Baxley, who was part of the Coalition for the Homeless and was on the board, was providing services to homeless folks. He would do that in our offices at the Coalition. So it was a program of the Coalition for the Homeless. 1 or 2 nights a week, he and some other doctors he recruited would provide those services in our offices.
Back then, it was a bit of an informal operation. I mean, we were operating within the administrative building of the Coalition for the Homeless under Michael Poole, who was the executive director at that time. So we were kind of informally seeing patients during the course of the evening that were residing at the Coalition.
So the Coalition of the Homeless took $50,000 of its savings, went out and formed a company called HCCH. And we went out and hired an executive director, a gentleman named Rick Dillard.
We started out with an empty building with no money and a whole lot of clients to serve.
So we went from seeing about 4 or 5 patients the first week or 2 to seeing 10, 20 patients a day using volunteer physicians to what it is now.
Rick Baxley, who founded the healthcare center, was one of my patients, my dental patients, and he came to me one day and said, "Hey, Gordy, I need you to help me, show me how to take out some teeth or take care of some people." And I said, "Baxley," I said, "what are you doing?" And he told me. And I said, "Well, why don't I just come down there with you?"
I joined at the very beginning with Rick Baxley. Dr. Baxley and Dr. Green initially started it, but primarily Dr. Baxley started it, and I was good friends with him, and right after he started it, then I joined him on the board of directors.
At the time, the clinic was a little clinic on the grounds of the Coalition. I think maybe 2 exam rooms, 3 exam rooms maybe. Very tiny. They had a couple of dental chairs, I believe. Everything was just crammed together.
I started with the homeless clinic in 1994, and I worked either 1 or 2 days a week for 13 years, I believe it was. And for 5 years or 6 years, I was chairman of the board. I was chairman of the board when this building was first developed and built.
Actually, Dick McGee and Will Gritter, 2 fantastic volunteers from the faith community, were with me, and we're driving around the neighborhood and saw a guy hitting in the sign saying "for sale" in front of this building. That was the first step there.
The one thing on top of the other is just falling into place, and what I started as just a simple clinic, seeing a few patients, has taken a life of its own. It has very little to do with me, just I'm the one that just saw the patients at the beginning in 1993.
I didn't see how you could stop it. I mean, the homeless people came faster than we healed. And it's still big. I don't know what it is now, probably 30 or 40,000 people out there, I guess.
This clinic served an enormously useful purpose. When it was first opened, homeless people in the community really had almost no place to go.
The need for something like this in Central Florida is great. We can't possibly meet the need alone. We do what we can.
It was a dream come true job because it was my passion for the homeless was very strong, but yet, I didn't, before I had the job with the Hope team, I just didn't know what I could do to help, and to be able to go out into the street and into the woods and meet them where they're at was wonderful.
I could tell right away, with any building that everybody knows, the basement is the most important. And there are a lot of great staff, volunteers, medical people that had created that base. And it could do nothing but grow from there and be fairly solid because of the tremendous job they did in that foundation, for the clinic.
Very impressive. It's nice to see that a company that I had a nice help in getting it started has blossomed into something so beautiful for our community.
When I see the homeless clinic here, I'm filled with some gratitude.
Iowa always has a special place in my heart for the healthcare center, as does all the people who started it.
It's just great, and I think our status in the community and the patient satisfaction with what we're doing is just a wonderful accomplishment.
At every stage in the path, we've had somebody that's been a champion. You know, I saw a few patients to begin with, and then Michael Poole came along, then Rick Dillard came along, and then several different other people have come along. And the last person to come along lately has been Bakari. And everybody that's taken an interest in it have pushed it a little bit further down the road. And it's been truly a group effort across the ages, across the last 20 years.